my name is Julia Uran, and today I'm introducing y'all to the public health issue, which is LGBTQ plus health and disparities in access and health outcomes. So the LGBTQ plus community faces many adverse health outcomes due to discriminatory factors, as well as disparities in access to healthcare. Some of these adverse health outcomes include poor physical health, poor mental health, lower income, substance abuse, psychiatric disorders, and non-communicable diseases. In this presentation, we will be discussing many of the discriminatory factors as well as disparities with regards to the 5 aspects of public health. Starting off with health policy and management, there are several policies in place from a national to a local level that affect the LGBTQ plus population in America. In addition, the existing healthcare system is built for heterosexual, cisgender individuals, making it difficult in numerous ways for queer folks to receive equal levels of care. For example, nationally, Section 1557 of the Affordable Care Act actually prohibits healthcare providers and insurance companies from engaging in discriminatory policies. So this would be supportive for the LGBTQ plus community. Conversely, Florida, state level, has many laws against the LGBTQ plus community, including SB 1580, which allows healthcare providers and insurers to deny service based on personal beliefs, which enables discrimination, and HB 1521, which criminalizes transgender individuals for using restrooms that align with their gender identity. However, county and local wise, we have supportive laws in place. So for example, in Alachua County, there's a 2019 conversion therapy plan, which states that being lesbian, gay, bisexual, or trans is not a disease, disorder, illness, deficiency, or shortcoming. And in addition, UF Health states that they're committed to improving the health and well-being of trans patients and non-binary patients. Similarly, they also state that they follow the World Professional Association for Transgender Health standards of care. Recommendation-wise, I would suggest to continue education on the topic because education leads to change and awareness. In addition to this, ensure that there are safe spaces and groups for people of the LGBTQ plus community, especially in states such as the ones pictured in these graphics that have states explicitly banning either like Medicaid for transgender people or laws that impact LGBTQ plus healthcare in general. Notice how Florida is one of them for both of those. And then vote in your local and national elections in order to elect more progressive politicians, which will lead to change and protections in place for these groups.
In the sphere of social and behavioral sciences, it is explained that there are multiple and complex layers that contribute to the health disparities and discrimination experienced by the LGBTQ community. It is observed through the individual relationship, community, and societal lenses provided by the SEM model. From an individual lens, internalized stigma affects the LGBTQ youth, such as the development of self-identity, social interaction, and intimate relationships. This leads to them more likely to experience bullying, and they are more likely to engage in risky sexual behaviors, increasing their chances of contracting STIs. Their relationship within their personal circles also influences their disparities, as a lack of familial and social support increases mental health issues by promoting isolation behaviors, suicide attempts, and anxiety. Within their respective communities, exposure to professionals such as healthcare providers with the lack of cultural competence results in most LGBTQ individuals avoiding seeking care to prevent being discriminated against. Policies have been adjusted to prevent discrimination on the basis of gender identity and sexual orientation on the federal level, but it hasn't always been the case. A study showed that after a ban on marriage equality in 2004-2005, the occurrence of mood disorders increased by more than 30% in comparison to the 20% decrease in other states without the ban. This shows how it is imperative that we understand the layers of environment that contribute to disparities in order to properly address it.
Biostatistics is fundamental to understanding the health disparities faced by the LGBTQ plus community and developing targeted interventions to mitigate these disparities. The application of biostatistics enables researchers and public health professionals to identify patterns, measure the prevalence of health conditions, and evaluate the impact of social determinants on the health of LGBTQ plus individuals. By analyzing federal, state, and local data, biostatistics uncovers the disparities in mental health, chronic illnesses, and access to healthcare services that LGBTQ plus individuals experience. For instance, statistical analysis of national data reveals that over 40% of LGBTQ plus youth have seriously considered suicide, and LGBTQ plus individuals report higher rates of mental health conditions such as depression and anxiety compared to their non-LGBTQ plus counterparts. Transgender and gender non-conforming individuals are more likely than their cisgender counterparts to self-report poor health, disability, and activity-limited days, while also facing increased risk of chronic illnesses such as arthritis and chronic fatigue. This data helps public health professionals prioritize mental health interventions for this population. At the state level, biostatistics highlights the socioeconomic challenges that exacerbate health disparities for LGBTQ plus individuals. In Florida, LGBTQ plus individuals experience higher rates of unemployment, food insecurity, and lack of insurance, which contribute to their poorer health outcomes compared to non-LGBTQ plus individuals in the state and their national LGBTQ plus counterparts. By quantifying these disparities, biostatistics provides evidence for the need for policy changes, such as Medicaid expansion, to improve healthcare access for LGBTQ plus populations. Local level data further emphasizes the impact of geographic location on LGBTQ plus health. In rural areas, 49% of LGBTQ plus youth reported that their community was somewhat or very unaccepting, compared to only 26% in urban or suburban areas. Additionally, 61% of LGBTQ plus youth reported experiencing LGBTQ plus based discrimination, and 21% reported physical harm, both of which are higher compared to their urban and suburban counterparts. Moreover, biostatistical analysis show that LGBTQ plus in rural areas have slightly greater rates of depression, suicidal ideation, and suicide attempts. Biostatistical analysis of these data allow for the design of targeted interventions that address the unique challenges faced by LGBTQ plus individuals in different settings. Overall, biostatistics is essential for measuring the extent of LGBTQ plus health disparities, identifying the factors that contribute to these disparities, and evaluating the effectiveness of interventions aimed at reducing them. Through rigorous data analysis, biostatistics help guide the development of evidence-based policies and practices that promote health equity for LGBTQ plus communities.
Epidemiology, which is the study of the spread of disease and how it affects populations, is important in understanding LGBTQ plus health disparities. Many diseases have heightened effects on the LGBTQ plus community due to discrimination, lack of access, and greater risk of comorbidities. One example is HIV. The incidence rate, or the number of new cases reported in a specific time period, was 4,606 in Florida in 2022, and the prevalence rate was 124,577. HIV is reported by gay and bisexual men more than any other population, and updating the electronic health record with more data could help doctors identify LGBTQ plus patients at a bigger risk of certain diseases like HIV and recommend preventative measures to help lessen HIV in the LGBTQ plus population.
For environmental health sciences, many interconnected factors and health outcomes effectively display the inequality that the LGBTQ plus community faces. The environment is all around and constitutes the built environment, such as workplaces, and the human environment, such as the quality of the air and certain natural disasters. Inequalities effects can be seen in all of these settings through the adverse health outcomes, such as the decline in mental and physical health for the LGBTQ plus community. For example, the LGBTQ plus community is overrepresented in low-income, unstable jobs due to the rigid gender norms that drive members out of traditional blue-collar jobs. The instability leads to many mental health issues. Also, members of the LGBTQ plus community often are forced into low-income, declining neighborhoods with poor air quality due to exclusionary stigma and policies. Last, for natural disasters like Hurricane Katrina, members of the LGBTQ plus community were blamed by religious groups, causing unfair access to disaster relief and treatment. The model to the right displays the interconnectedness between factors and health outcomes and how a one-size-fits-all approach is unreasonable when it comes to addressing this issue.
To effectively address LGBTQ plus health disparities, several key recommendations should be implemented. First, integrating sexual orientation and gender identity data collection into electronic health records is crucial. This integration improves the tracking of health trends and enables targeted interventions for LGBTQ plus populations. By systematically collecting this data, healthcare providers can better understand and address disparities such as higher rates of depression, anxiety, and chronic illnesses among LGBTQ plus individuals. This approach supports personalized care, enhances patient outcomes, and informs necessary policy changes, as highlighted by Bose et al. 2018. Another important recommendation is to enhance cultural competency training for healthcare professionals. Training programs should focus on using inclusive language and understanding the unique needs of LGBTQ plus patients. While over 80% of healthcare workers express confidence in using appropriate terminology, less than half are fully aware of specific legal challenges related to LGBTQ plus care. Improving this aspect of training can reduce discrimination and improve patient-provider relationships, leading to better healthcare outcomes. This need for enhanced cultural competency is supported by the data from the Second State of LGBTQ plus Health National Survey and in findings in Achieving achieving health equity for LGBTQ plus adolescents. Finally, supportive educational interventions are essential. Early education and continuous training on LGBTQ plus health are vital for developing competent healthcare providers. Studies show that nursing students benefit significantly from targeted LGBTQ plus health education, which translates into more inclusive care practices. This evidence is detailed in the Systematic Review LGBTQ plus health education interventions for nursing students from Science Direct. Implementing these recommendations will contribute to reducing health disparities and improving overall care for LGBTQ plus individuals.